Magandang umaga po sa ating mga media partners and to all our public viewers via Facebook and YouTube. And welcome to the DOH Beat COVID-19 Media Forum for August 23. Happy Monday po sa ating lahat, and to give us the latest updates on our COVID-19 response and other public health services, here is DOH official spokesperson, Maria Rosette Vergere. Magandang umaga, Yusek.
Yes, good morning din at magandang umaga po sa inyo lahat. Welcome to our Monday's Media Forum. Ito pong mga nakarang araw, laman po ng mga balita ang 2021 Consolidated Annual Audit Report. 2020 Consolidated Annual Audit Report. Ang paunang ulat na ito ay parte ng normal na pagsusuri ng Commission on Audit at naglalahad ng mga rekomendasyon na kailangang gawin ng Kagawaran ng Kalusugan. Isinasaalang-alang po namin sa Department of Health ang mga rekomendasyon ng ating mga state auditors upang mapabuti natin o ma-improve pa po natin ang aming mga proseso at mga binibigay na serbisyo ng aming kagawaran. Kaya naman po inatasan na ng ating Secretary of Health ang lahat po ng heads ng aming mga opisina, mga operating units ng DOH na mag-comply at mag-submit ng mga documentary requirements na hinihingi ng Commission on Audit sa pinakamadaling panahon. Kaisa po namin ang Commission on Audit sa pagsasaayos ng ating mga proseso upang lubos na mapabuti ang serbisyo nating hatid sa ating mga kababayan. Katuwang din po namin mga kasama natin sa media ay layuning maghatid ng tama, kompleto at malinaw na impormasyon at responsable at makabuluhang pamamahayag para po sa ating mga kababayan. Ngayon po, ang pangatlong araw ng ating Modified Enhanced Community Quarantine sa National Capital Region at iba pang lugar. Ang desisyon po ng IATF na ilagay sa MECQ ang NCR ay ginawa upang mabalanse ang buhay at pangkabuhayan. Hindi lang po malawakang lockdown ang maaaring solusyon natin dito sa mga pagtaas ng kaso. Maaari po nating ipatupad ang granular lockdown sa tulong ng ating mga local governments at limitahan po natin ang activities na mataas ang panganib sa pagkakakuha tayo ng COVID-19. Kasabay po din ito ang pataasin natin dapat ang ating vaccine coverage, paiksiin po natin ang case detection to isolation, at pag-igtingin po natin ang pagsunod sa minimum public health standards. Lindsay?
Thank you very much po, Yusek. I will now be going through the questions sent to us by our media partners. From Aiko Miguel, do we have further details on the Lambda variant, and are we also preparing for its possible impact to the Philippines healthcare system? Will this also have a big impact on the Philippines COVID-19 case?
Well, Aiko, as of today, investigations para sa Lambda variant, nagbigay na ng report sa amin na lahat ng identified close contact tested negative for COVID-19. Furthermore, hanggang sa ngayon, wala pa ho tayong nadedetect na additional cases ng Lambda variant. Ang Department of Health po is continuously coordinating with our local governments to trace and test all of the contacts and determine yung transmission po nitong na i-identify natin na variant of interest. Atin din pong inaayos yung ating mga healthcare capacities regardless of the distribution of variants of concern or variants of interest in the country. So ito pong ating Lambda variant na na-detect, this is still a variant of interest. So ibig sabihin, hindi pa ho nabibigyan ng WHO ng classification na variant of concern, meaning yung characteristics po ng virus, hindi pa ho nakakapagbigay ng significant health impact sa mga populasyon. Kaya ngayon po yung pagbabakuna natin, isa po yan sa magiging paraan natin para maproteksyonan tayo kung kahit na ano pong variants ang meron tayo dito sa ating bansa.
Thank you po, Yusek. From Rafael Bosano and Aiko Miguel, UPPGC, in their opinion, thinks there is community transmission already. What other factors are we considering why the DOH, together with its experts, has not confirmed it yet? How do we confirm if community transmission is already happening? And how many more cases need to be confirmed before a confirmation can be made?
Yes, Rafi, no, actually, it's not the number of cases that we are looking at when we talk about community transmission. The main definition of the WHO is that there would be a lot of clustering of cases, and also there is no linkage anymore between and among cases that we have identified. So for this Delta variant, katulad ng aming sinabi mula pa nung nag-umpisa tayong makadetect ng variant na ito, ay sinabi natin that we are assuming that there is already community transmission. Specifically nga dito sa NCR, nakita natin yung biglang pagtaas ng mga kaso at saka pagtaas nung nade-detect natin na Delta variant. So the assumption is there, lahat ng action natin ay geared towards that level of community transmission already. But as to confirming it, kailangan kasi namin ng ebidensya. Because this is a classification. Actually, this is a technical thing, no? When we classify and announce na community transmission na talaga kasi kailangan mo ng ebidensya para dyan. Pero on the other side, actions are geared towards community transmission already. So currently, we have seen and observed, no, especially in NCR and Region 4A, na talagang mukhang community transmission na ito. Nakita natin na wala ng link ang mga kaso sa bawat isa. We are seeing clustering of cases in these two big regions. Kaya iyan po ay isang bagay na pinagtutuunan natin ng pansin sa ngayon. So again, let me just reiterate that the Department of Health, together with the whole of government, has been acting as if there is already community transmission from the start. And second, for us to be able to pronounce or to say and confirm that there is community transmission, we need further evidences. And alam nyo po na yung ating pagdedetect ng mga variants ay limitado po tayo sa ngayon. So yung ating pong analysis, yung phylogenetic analysis, hindi pa po yan masyadong nakukompleto. Although, as I've said, katulad din ng advice ng WHO sa atin, kailangan natin ito tignan per area or per region in the country. We cannot make it na tinitignan natin in totality ang lahat ng regions. Kasi meron naman din mga ibang lugar pa rin dito sa ating bansa. Wala pa nung level ng community transmission, local transmission pa lang siya. But definitely, I can tell all of you, Region 4A and NCR na andyan na po, no? We can observe that already, although we need further evidence, but there is community transmission already in these areas.
Very much, Yusek. From Donna Z. Pasibugan, what do you think PhilHealth should do regarding its circular suspending payment claims? And what is the comment of the DOH on medical associations planning to disengage from PhilHealth?
Well, unang-una, nagpalabas na po ng explanatory or advisory ang PhilHealth, no, na 2016 pa ho nilang polisiya ito. Kailangan din po maintindihan ng ating mga kababayan, parte po ito ng proseso ng PhilHealth that whenever they evaluate claims made by our facilities or providers, kasama po yan na kung halimbawa meron po kayong mababiolate as to the given policies of the Philippine Health Insurance Corporation, and then of course it has to be investigated. So ito ho, sana maintindihan ng ating mga kababayan, we are part of government, PhilHealth is part of government, and the money that we are spending for us to pay for these claims coming from the providers are coming from the pockets of people, di ba? Yung mga taxes natin. So kailangan pag-iingatan nila yung pondo na yan. Kaya meron ho tayong check and balance within our processes, and that is what PhilHealth is doing. Kaya sana po nakikiusap tayo, especially to our medical providers, our medical associations, nakikipag-dialogo po ngayon ang PhilHealth sa iba't ibang asosasyon medical para po maipaliwanag nila ng mas maayos. Wala po tayong pinagbibintangan, wala pong inaakusahan ang PhilHealth. Ito lang po ay kaparte lang talaga ng proseso ng gobyerno.
Maraming salamat, Yusek. What does our COVID-19 data after the ECQ indicate whether we were able to minimize transmission and overwhelming of our hospitals?
Well, as we always say, no, we cannot really experience or observe kung ano man ang mga naging epekto ng restrictions na pinapatupad until after about 2 to 3 weeks, no, after the end of these restrictions na pinatupad natin. So we ended yung ating restrictions ng ECQ last Thursday And hopefully in about 2 to 3 weeks, we will see some forms of improvement sana based on what we have or how we have implemented the ECQ.
Thank you, Yusek. Again, from Rafael Bosano. Has the DOH been able to monitor if LGUs have already shortened the period of detection to isolation, as well as the other measures that need to be done to cut chains of transmission? If an LGU is not able to do this for the lack of resources or personnel, how is the DOH helping them?
Yes, Rafi, no, alam mo, napaka-importante yan. In our current projections, there were 3 factors that were identified and included as part of the assumptions. The first would be vaccine coverage. The second would be as a proxy to our PDITR strategies would be the shortening of the detection to isolation of different individuals exposed or confirmed with the virus. And the third would be the compliance to minimum public health standards. Dun sa projections natin based on these assumptions that we have included, if only we can reach the target, no, kung ano yung kailangan para atin pong mapigilan ang further na pagtaas ng kaso, bababa po ang kaso. I mean, we are not going to reach that targeted projection na sinasabing mga numero. So dito po sa atin sa vaccine coverage, katulad niyan, kailangan ma-improve natin. Ano? And we are seeing that in the National Capital Region specifically. And the other regions had been given their supplies already and we are ramping up ang vaccine coverage. So may target ngayon ng National Capital Region 200 to 250,000 jobs per day. So that we'll be able to achieve that coverage para maipababa po natin ang mga kaso in about 1 to 2 months yung epekto ng bakuna. Pero ang pinaka-immediate na pwede nating marelayan would be yung shortening ng duration from detection to isolation. Kaya ngayon po, ang mga local governments, nag-active case finding sila. Nagbabahay-bahay po sila, ina-identify nila sino po yung mga may sakit sa household, sino po yung na-expose or close contact, at ini-extract po nila kung hindi po ayon ang kondisyon ng kanilang pamamahay sa quarantine. In this way, we can be able to shorten yung detection to isolation. And ang pangatlo, yung minimum public health standards. So itinatala natin ngayon na ang pag-comply sa minimum health standards, medyo may mga violations pa rin tayo during the ECQ period. Pero ngayon, katulong natin ang DILG at mga PNP, and they are now going to be roaming around just to enforce minimum public health standards. This kind of visibility is very important so that we'll be able to have people or encourage them to really comply with the minimum public health standards. Ano po ang ginagawa natin sa ating mga local governments na tulong, nabibigay na tulong, nakapag-deploy po tayo ng mga nurses. Kung matatandaan nyo, yung Nurses Deployment Program, nakadeploy po yung mga nurses na yan sa ating mga public health systems. So katulong po sila sa paggagawa ng contact tracing, sa pagsasaayos po ng response dun sa local government. Ang pangalawa naman po, meron din po tayong mga indirect supervision and direct supervision over our epidemiology and surveillance units. So linggo-linggo po, minimit natin lahat ng ating surveillance officers together with our assistant regional director so that we can better guide them at masabi natin kung ano ang dapat gawin for surveillance so that we can help in these factors that I have identified. And the third, sa contact tracing. Napaka-importante ng contact tracing ngayon. And itong ang active case finding natin talaga ang makakapagbigay ng malaking dent or effect dun sa ating ginagawang response. And just recently, the President already has approved, according to Senator Bongo, itong pag-hire or pag-extend ng contract ng mga DILG contact tracers for another 5 months. So this would be a very big help dito sa ginagawa natin ito.
Thank you, Yusek. From Carolyn Bungkin, what is the updated projection on the number of active cases in NCR and nationwide by the end of September now that we have shifted to MECQ?
Yes, Caroline, so based on our latest projections, updated projections based on the case numbers and the assumptions that we have included, as I've mentioned a while ago, kapag tayo ay may mga scenarios siya na ibinigay, and ang scenarios natin would be merong ECQ for 2 weeks plus 4 weeks MECQ. Ito ay mag-umpisa ng August 21 at mag-end ng October 1. Meron ding isang scenario na MECQ for 6 weeks, that's August 21 to October 1. Meron ding isang scenario na MECQ ng 4 na linggo at 2 linggong GCQ with heightened restrictions, and that's August 21 to October 1 also. So when we do ECQ, start August 21, 2 linggo, at saka 4 na linggong MECQ, makakapagkaroon tayo ng active cases sa NCR by the end of August ng 66,403. Kapag end of September, we'll have about 269,000 plus active cases. That is the current. No? Ibig sabihin ng current, wala tayong na-improve sa ating vaccine coverage, sa ating minimum public health standards, at saka yung detection to isolation, hindi natin napaikli. Pero kapag naipaikli natin, magkakaroon tayo ng about 255,000 by the end of September. Now for MECQ, when we look at this, ang current, kung hindi tayo makapag-improve, it's about 71,000 plus active cases by the end of August and 330 active cases by the end of September. But if we are going to improve all of these factors, we will have about 83,000 plus active cases by the end of August and 152,000 by the end of September. And for the last scenario, 4 weeks MECQ and 2 weeks GCQ, 83,000 by the end of August, and by the end of September, it's 158,000 active cases. Kailangan maintindihan ng ating mga kababayan na ito po ay projections. Hindi po necessarily na talagang mangyayari ito. Ito po ay hindi mangyayari o ma-prevent natin na mangyari o mapapababa po natin yung projected number of cases if we can improve on vaccine coverage, on the shortening of our detection to isolation, and the compliance to minimum public health standards. So it doesn't mean that if we say that there's going to be 100 plus active cases by the end of September, mangyayari po siya. Pwede po siyang hindi mangyari at mapababa po natin ang mga numerong to kung magagawa po natin yung 3 factors na sinasabi po natin ngayon.
Thank you po, Yusek. I guess that answers yung next question po din po ni Caroline on how will DOH, government, and the public cope when active cases in NCR reach the 269,000 projected. So Yusek, I will now be going through the questions sent to us in our chat box po. From Lay Alves, a consulting firm, says bumababa daw ang growth rate ng COVID-19 cases sa NCR. Ano po ang mga rekomendasyon para masustain ito ngayong mas marami na ang lumalabas?
Well, pag tinignan natin, kaya nga tayo nag-shift sa MECQ para mabuksan natin yung ibang sektor na kailangan magtrabaho. Pero wala pa rin tayong non-essential na pinapalabas. Pangalawa, ang mga local governments natin, aside from this MECQ, which is mas malaki na restriction in an area like whole of NCR, merong granular lockdowns, may mga sariling restrictions. Like they have curfews, meron po silang mga restrictions sa mga bawal lumabas, lalo na kung sila ay nagkakaroon ng granular lockdown. So kailangan lang po nating ipagpatuloy ito pong mga ginagawa natin, and we are very thankful for the local governments dahil alam po namin na talagang sila po ay yung effort na ine-exert nila ngayon para po makontrol po natin ang transmission ng sakit na ito ay abot-abot. No? So tayo po ay nagpapasalamat sa kanila, pero kailangan tayo mga individuals, meron din tayong contribution. Kapag hindi kailangan lumabas, huwag na muna po tayong lumabas. Lagi po tayong susunod dun sa mga safety protocols na amin pong araw-araw na sinasabi para po tayo hindi ma-infeksyon.
Thank you, Yusek. From Lay again, kailan daw po matatanggap ng healthcare workers ang kanilang special risk allowance?
Yes, Lay. No? So there was this instruction already immediately after that order coming from our president that the secretary already issued this order to all of our units concerned na iayos na nila, i-prepare nila yung mga listahan ng additional healthcare workers na ilalagay pa sa listahan para mabigyan. So ngayon, kami po ay nakikipagtrabaho sa Department of Budget and Management, and nakapag-identify na rin po kung saan kukunin ang pondo. Meron hong mga savings dun sa aming miscellaneous funds, yung benefits for miscellaneous benefit funds kung saan nakapag-identify po ng kaperahan para magamit natin yan. DBM, on the other hand, will be asking for the approval of the Office of the President that the DOH can be able to use these contingency funds para mabigay po natin yung SRA ng mga healthcare workers na idinagdag po dun sa listahan. So within 10 days po ang binigay sa amin ng ating Pangulo at ito naman po ipapatupad natin sa lalong madaling panahon. Inaayos lang po at hinaantay din lang natin ang sagot ng Presidente sa DBM so that we can use that funds to pay for this. What we are doing right now, kahapon po ay nagkaroon na ng pakikipag-usap ang ating mga tauhan ng admin and finance natin sa mga hospitals concerned na naghihingi pa ho ng additional for their workers na hindi nakasama sa unang listahan. They were asked to submit already the list as soon as possible and we gave them a deadline until Thursday of this week so that we can be able to finalize our computations and pag pumayag na po ang DBM, we will already be able to issue the funds for these additional healthcare workers.
Thank you, Yusek. Clarification po from Caroline Bongkin. What specific evidence is DOH still looking for before officially declaring a community transmission of the Delta, despite seeing clustering of cases and no linkage between the cases?
Caroline, actually yung linkage talaga, no? Kasi clustering, we have evidence of that. We monitor clustering every day dito po sa mga iba't ibang lugar natin. Pero yung linkage talaga. And we know that hindi po lahat naman ng tao na nagkakasakit ngayon ay natetest for the Delta variant. And we know that limitation. So kapag nakakita tayo ng mga kaso or clustering in an area, tumataas ang kaso, alam natin that there is already the presence of the Delta variant in areas. But we don't know if these individuals are having or has the Delta variant. Kung yun yung variant na meron sila sa kanilang sistema. So yun pong ebidensya na para masabi natin kung may link o wala, we cannot do that right now because of this limitation. But as I've said, hindi naman po natin haantayin yung classification na yan o yung mga ebidensya na yan. We're acting as if there is already community transmission. And actually, we have identified regions already that the probability is very high that there is already community transmission because clusters are being identified and also nakikita natin na mukhang wala ng mga link yung mga nagiging infection kapag gumagawa po tayo ng contact tracing.
Thank you, Yusek. Inaasahang mabibigyan na ng full approval ang Pfizer COVID vaccine sa Amerika. Ano ang implikasyon nito sa Pilipinas?
Syempre kapag nagkakaroon ng mga approval sa ibang bansa nito mga emergency use authority, katulad nito, ang Pfizer, kukuha na siya ng CPR. Yan yung sinasabi. So, they will have this marketing authority already. Kapag may CPR po tayo, Certificate of Product Registration, ibig sabihin po, mapuputol agad yung EUA natin. So, here in the Philippines, we will be waiting for that. If they will apply, that will take for us to evaluate again. If talagang compliant na ang manufacturer para makapagbigay na talaga ng marketing authorization ang ating bansa para dito sa ganito. Kapag nagkakaroon po ng CPR na ang isang produkto, mapuputol po yung EUA natin, yung Emergency Use Authority. And that magkakaroon na rin po ng open access even with the private individuals and the private sector ang bakunang ito kung sakasakaling magka-CPR na siya. But again, it has to go through a regulatory process and the evaluation of our experts.
Thank you po, Yusek. Yusek, if you have the data now, how far are we from achieving the target goal sa 3 aspects po na pwedeng makatulong sa pagbababa ng kaso gaya ng contact tracing, shortening the duration of case detection, and vaccination po?
Sa ngayon, pag tinignan natin yung ating detection to isolation, for the whole country, it's 9 days. For the whole of NCR, because of varied implementation, we have 12 days. So pag tinignan ho natin, medyo mahaba pa yung period na yan from detection to isolation. Tinilagay po natin doon sa assumptions natin would be 6 days. Kung may bababa natin ng 6 days yung yung detection to isolation, we'll have improvement in our projected numbers. Kaya sa ngayon, iyan po ang pinagtatrabahuhan natin, DILG, DOH, together with the local government so that we can shorten this. That's why we're doing active case finding. As to contact tracing, our average nationally ngayon is 1:6, no? So malayo pa rin po yan dun sa inaibigay ng ating contact tracing czar. But we can see pockets, no? Specific areas that they are doing good in contact tracing. So kailangan lang po talagang pag-igtingin ang case finding na aktibo sa bawat lugar para po talagang matrace natin lahat ng merong contacts at maputol ang transmission sa community.
Yusek, follow up on that, parang ano daw po yung mga nakikita nating factors kung bakit mababa or mahaba pa rin yung time ng tracing, contact tracing to isolation po ng ating cases?
Maraming factors dyan, and there are individual factors also. Unang-una, pag tinignan natin yung detection to isolation, it starts with the patients themselves, di ba? Halimbawa, nakakaramdam na tayo ng simptomas, marami po sa atin, nagsi-self-medicate muna, hindi iniisip, baka COVID na yon. They will wait time, no? They will wait for time before sila magpakonsulta kapag talagang sa tingin nila ay kakaiba na yung kanilang nararamdaman. Nung ginawa po natin itong pag-aaral na ito, meron po tayong mga factors na kinonsider from detection to isolation. First would be yung sa parte ng individual kung kailan ta magpapakonsulta. That's health-seeking behavior. And we found that it took about 3 to 4 days before an individual will go and get themselves tested or consult a doctor. Pagkatapos, syempre magpapatest sila. Yung testing po, pag na-test sila maybe on the 3rd or the 4th day, aantay makalabas ang resulta, and usually the average is about 48 hours. So that's another thing. And then bago po ma-action na naman ng local governments, from the time that they receive the result, mag-contact tracing, mag-isolate, it takes about 3 days again, no? So pag tinignan natin yung cycle na yan, iyan po yung mga factors na tinitignan natin. So health-seeking behavior, testing, and also yung action ng local governments to isolate the individual. So these are the 3 things that we need to improve on right now.
Thank you, Yusek. From ICO, US FDA already warned that ivermectin is not a COVID-19 treatment drug. Will the DOH also issue an official statement? And do we have updates regarding sa kondisyon ng mga nabigyan ng ivermectin, especially during the distribution in sa Quezon City before?
Aiko, hindi na namin kailangan magpalabas pa ng additional advisory. We already have existing guidelines. Meron na rin po tayong mga rekomendasyon galing sa ating mga eksperto dun sa Living CPG. Andun na ho sa clinical guidelines yan na makikita natin sa mga website ng DOH. At saka meron na rin hong regulatory policies ang FDA na naipalabas na rin. So hindi na ho tayo magpapalabas ng additional. We just like to remind our citizens na ito pong mga bagong mga gamot o mga existing na gamot na gagamitin, no, repurpose na mga gamot para sa COVID, kailangan mag-ingat po tayo. Dahil pangunahin po sa ating gobyerno ang maproteksyonan kayo dahil gusto namin at ang ating hangad ay lahat ng inyong iinuming gamot ay magiging safe para sa inyo at para sa inyong pamilya, of course. Pangalawa, yung mga monitoring, wala naman po tayong naitatalapa at naire-report sa ating Food and Drug Administration ng any adverse reaction ukol dito sa pag-inom ng gamot na nag-distribute sila. But of course, we will continuously monitor.
Thank you, Yusek. From Red Mendoza, may ilang remarks daw po na nasa local government unit yung problem ng payment ng special risk allowance, and why can't the DOH give it directly sa hospitals? Yusek, if we can explain po yung process and how are we streamlining po yung pagbababa po ng provisions na ng ganitong mga healthcare worker benefits sa ating mga healthcare workers.
Wala po tayong statement na sinabi na may nasa local government units ang problema kung ba't hindi na ibababa. Kailangan lang po maintindihan ng ating mga kababayan yung proseso natin, how we do this. What we do is we secure funds sa national para po dito sa allowances or benefits ng ating mga healthcare workers. Ang ating pong mga regional office at saka mga ospital natin, they submit their list so that we can estimate how much we need to download. Pag nakuha na ho natin yung amount na yan in full and we have consolidated all of these requirements, binababa natin ang pera. Binababa po natin sa regional office namin for the LGU and the private hospitals and dun po sa aming mga specific na ospital namin mismo sa DOH. Pagkababa po natin na yan, meron naman po tayong polisiya na no, on how we are going to spend this, ano ang kailangan requirements ng ating mga facilities para they can already be able to comply at mabigay ang pondo. Hiningan po ang LGU and private hospitals ng Memorandum of Agreement because that's the only way that our regional office can transfer funds to them because they are not part of the DOH family. So isa po yan sa naging bottleneck din, no? At medyo na-delay dahil yung, syempre, for you to be able to perfect, no, ang isang MOA ay may mga legal clearances pa yan from both sides. Pangalawa, yung MOA, kailangan nakapasok doon yung listahan ng mga healthcare workers na sa tingin ng mga bawat ospital ay eligible. Now, ang nangyayari po kasi pagka-submit nila, syempre may validation team din po kami dun sa aming regional office because we cannot just provide the funds na hindi namin chinek dahil meron pa rin po tayong mga procedures in government. So we were able to evaluate at some of the healthcare workers were evaluated as ineligible dahil hindi po ayon dun sa mga pamantayan natin sa provisions ng batas at policies. So naibabalik, babalik huli sa amin and all. So yan po yung naging proseso natin. That is the process on how we do that. And now as to the recommendation na idiretso na lang sa bawat ospital, yan po, nakikipag-usap tayo ngayon, no, how we can be able to streamline processes para hindi maraming layers, para po bumibilis ang pagbibigay ng ating mga benepisyo sa ating healthcare workers. Pinag-uusapan po yan ngayon, nakikipag-usap tayo sa ibang ahensya rin ng gobyerno dahil alam po natin may limitasyon tayo sa direct fund transfer to private and to local government facilities dahil hindi nga po siya parte ng DOH family. So we're trying to find ways so that we can streamline para po sa mga susunod na batches, hindi na po ganito ang proseso natin. We are trying to improve our processes.
Thank you, Yusek from Red Mendoza. Sinabi po ni Dr. William Hasseltine, isang former professor ng Harvard Medical School and an infectious disease expert, na the Philippines may be the next New Zealand kung magiging draconian lang po ang response natin like a 3-week lockdown. Ano po ang masasabi ng Department of Health?
First, we're open to criticisms. Minsan yung mga criticisms na po na yan ay ang nakakapagbigay sa amin ng tulak para kami po ay mas makapag-improve ng ating mga sistema at proseso. Pero kailangan din po natin maintindihan that the wide yung malakihan ng mga lockdown at restrictions ay mukhang hindi na po nagiging effective para sa atin dito sa ating bansa. We have implemented these lockdowns for how many times already? Last March of 2020, nag-July and August tayo, tapos ito uling March and April of 2021, and now. So pag tinignan ho natin, when we were trying to analyze together with our experts, looks like it's not really being effective anymore. So although alam natin malaking bagay yan to restrict ang mapangmalakihan, pero sa tingin namin, nung wini-weigh namin ang mga maaring mangyari, mas magiging effective at mas magiging advantageous para po sa ating lahat kung bababaan natin ng konti, pero mag-granular lockdowns tayo at i-improve po natin yung mga factors dun sa PDITR natin. So kaya po yun yung naging rekomendasyon. And we all know that in most of the countries, all over the world, nakikita ho natin na unti-unti rin naman nagbubukas sila ng kanilang ekonomiya, but still they have this kind of restrictions locally. So yun po ang gusto nating tignan, and as to the health side sa amin sa DOH, as long as we can be able to have this active case finding, we can be able to improve the vaccine coverage, shorten the duration from detection to isolation, compliance to minimum public health standards are enforced. Yun pong MECQ plus this is already something that we can rely on as long as all of us will continue to cooperate para po bumaba ang mga kaso.
Thank you po, Yusek. A follow-up question from Kat Domingo. If you have the figures po now, magkano po ang savings na nakuha from the Miscellaneous Benefit Fund, and do we have a ballpark number po kung approximately ilang healthcare workers ang makocover nito?
We have identified yung healthcare workers na around 20,156 private and public healthcare workers na ina-additional natin dun sa existing list natin. And ang worth nito is 311 million pesos para bayaran po natin itong additional na list. But that's not final yet. Kailangan po naming antayin yung talagang final list na isusumiti sa amin ng aming mga facilities at regional office para magkaroon tayo ng final number at saka final amount that we need. So ito pong 311 million, we can source it out from our contingency fund, to which the DBM already has asked the approval coming from the Office of the President.
Thank you po, Yusek. From Mikhail, how many contact tracers do we have now nationwide, and how many tracers stand to benefit from the extension of their contract by 5 more months?
It's about 15,000, Mikhail, for this extension. Yan po yung binigyan ng pondo at inaprubahan for another 5 months. That means that's until the end of the year.
Thank you po, Yusek. And from Greg po, Hospicio de San Jose in Manila has already recorded 80 COVID-19 cases so far, including children and elderly. Has it been monitored by the DOH, and how are we assisting the situation?
Yes, we have coordinated with them already. We got this report, I think that was Friday or Saturday, and nakausap na po natin yung kanilang si sister, yung administrator, and we are helping them right now trying to find facilities also kung kailangan po namin i-extract ang iba para po hindi magtuloy-tuloy ang infection.
Thank you, Yusek. And lastly po, from Aiko, pahabol po, ano po ang measures na gagawin ng DOH sa mga nagsusulong pa rin ng ivermectin?
Ganun pa rin naman po. We have our regulatory processes in place kung saan ang ivermectin naman ay may compassionate special permit na sinasabi. Pero kailangan din may nag-a-apply ng CPR. I don't know if they were approved already, but in any case, yun pa rin po. Ang DOH is not recommending ivermectin at patuloy po naming bibigyang paalala ang ating mga kababayan ukol sa gamot nito at sa paggamit ng gamot na ito. Na ang ivermectin kahit po sa ibang bansa, and now it's the United States na Food and Drug Administration na nagbigay na po ng paalala na ito pong gamot na ito ay hindi maaring gamitin sa COVID-19. Ito pong gamot na ito, napakita na po ng ebidensya, doesn't give you any benefit at all in preventing, in shortening the duration of your hospitalization or preventing the progression of your disease when you have COVID-19. Ito pong gamot na ito ay mga side effect din na maaring maging harmful sa inyong katawan. So again, paalala sa ating mga kababayan, uminom lang po tayo ng mga gamot na rehistrado at saka nire-recommenda ng Department of Health para po hindi po tayo magkaroon ng mga harmful or mga adverse reactions coming from these drugs.
Thank you, Yusek. Lastly, may pahabol daw po ulit. May development na daw po ba yung mga investigation before ng mga previous incidents of ivermectin distribution?
Nakausap na natin ang iba't ibang ahensya tungkol dito. So we leave it at that because it is still being processed naman. But we already have coordinated with them. We had meetings with them actually already.
Thank you po, Yusek. Before we officially end our media forum, meron po ba tayong final messages para sa ating media partners and of course to the public?
Yes, thank you very much, Lindsay. Gusto ko lang magpasalamat sa ating mga media partners. Alam po namin, katulong namin kayo sa pagpapakalap ng tamang impormasyon sa ating mga kababayan. Paulit-ulit po naming ipapaalala ang pagsunod nating lahat sa minimum public health standards. Ito po yung isa sa pinakamabisang depensa natin laban sa COVID-19 kahit ano pa kung variants ang meron tayo ngayon dito sa ating bansa. Ang maagang pagkonsulta sa doktor o medical professional ay napaka-importante upang mapigilan po natin ang transmission o pagkalat ng virus sa ating tahanan, sa ating komunidad at lugar ng trabaho. So kung kayo po ay makakaranas na ng kahit na anumang simptomas ng COVID-19, maaari po ay mag-isolate na po tayo, tumawag na po tayo sa ating local government unit para po sila ay makatulong na sa atin, mabigyan kayo ng abiso kung ano po ang kailangan nyong gawin. Piliin po nating protektahan ang ating sarili, pati ang ating pamilya sa pamamagitan po ng pagbabakuna. Ang pagbabakuna po ng vulnerable population, ng ating mga lolo at lola o mga senior citizens, at yung mga taong may comorbidities ay susi upang mapanatili po nating manageable ang ating healthcare system at maiwasan po natin ang panganib ng pagkamatay dahil sa COVID-19. Ang paglaban po sa COVID-19 ay hindi po makakayanan mag-isa ng gobyerno. Magtulungan po tayo, kailangan po namin kayong lahat. Magsama-sama po tayo, lahat po tayo ay may responsibilidad para po makatulong dito po sa ginagawa nating response sa COVID-19. So yun lamang po, mag-ingat po tayong lahat and we will see all of you on Wednesday. Thank you, Lindsay.
Thank you very much po, Yusek, and maraming salamat po sa ating media partners and to all our viewers for today. Happy Monday and ingat po tayong lahat.